Okay, this is how we set up Acteon Sopix2 sensors inside of Eaglesoft and Eaglesoft Imaging. Once you download your sensor drivers, you go up here to File, Preferences, select X-ray. Make sure this Use Scanner Default Interface box is checked. Go down here to Scanner, select Twain Sopix2. This will automatically populate once you download your Sopix2 drivers. Select OK. OK. That'll make all your preferences stick. Select a test patient. All right. And now we're going to customize a template. All right. So we go down here to Other Template. We'll select a full mouse series in this case, just for demonstration purposes. All right. Go down to Edit and ask them what they want the sequence to be for the mounts throughout the template. Let's say they want to start in this upper left-hand corner. Click on that mount, go down here to Sequence. We'll make that number 1. And then let them tell you how they want the sequence to go from there. So if this is going to be number 2, and again, just let them lead the way here. But this is how the sequence would go if they were instructing you, okay? So from there, we need to make sure our image orientation is right for all the various mounts throughout the template. Everything on the left-hand side, okay? So if we start here with number 1, the image orientation will be to the right. It'll say do not rotate. You take off all flips and or mirrors for our sensors inside of Eaglesoft, all right? So if we go to number 2, again, image orientation will be to the right. It'll say do not rotate. And in this case, we take the flips off. Everything on this left-hand side will do the same thing. Okay, for the right-hand side, your image orientation will be to the left. It'll say rotate 180. And in this case, we take the mirrors off. Okay, image orientation to the left, rotate 180, mirrors off. And that's for everything on the right-hand side. All right, for your upper anterior PAs, the image orientation is going to be down, rotate 90 degrees. In this case, we take the flips off. Image orientation down, rotate 90 degrees, flips off. Lower anterior PAs, image orientation is up. It'll say rotate 270, take the flips off. Image orientation up, rotate 270, take the flips off. If you set up a vertical bite wing series, it would be the same, okay? Vertical bite wings would be the same as lower anterior PAs. You would want your image orientation to be up, rotate 270. All mirrors and flips are always off. Your default source goes from a sensor in this case to a scanner. We're always going to be a scanner default, okay? And we're going to rename the series. You don't want to rename the series right here because that'll change the series that they previously have created, and they might still want to use a Schick sensor or say a ScanX system. You want to leave their existing templates as is. We want to go here to Save As, and we'll rename a series. We'll call this one FMX18 Sopix2, okay? And then that way, when we go into the new exams, we'll see right here, FMX18 Sopix2. We select that. We can see the sequence, the progression that we selected is correct, all right? We go up here to Acquire. Now this is important, this is critical. Our default is always to the right on the woman's face of our little applet, okay? That's our default positioning for the sensor. If you change it or if someone in the office changes it, your image orientation inside of the mounts will change. We always want to be here to the right of the woman's face. If you're looking at it, it's to the left. That again is our default orientation on our applet. You have to do that in every operatory, okay? The setup, you want to go down here, select X2. That's our filter default, and you also have to do that in every operatory. The templates should go systemic if they're networked properly, so you don't have to do that in every operatory. You just have to do it on one, and that's it.